Hi everyone, and welcome back to Talk Doula To Me. You are here with myself, Nicole. I am a doula in the area, as well as Kelly and Kristen, and we have an amazing special guest today, and that person is Hailey. She is one of our local midwives, and we are super excited to meet you. So Hailey, tell me a little bit about yourself. Who are you?
Excited to be here too. It was a full day at the office today, and I'm happy to be done. Lots of babies and bellies, and feeling good. Some good oxytocin floating around from today. A little bit about myself. I am a licensed midwife. I've been practicing in the Treasure Coast area for about 6 years now. I am a graduate of Common Sense Childbirth School of Midwifery, which is one of the gorgeous schools in Florida. I see a lot of moms and babies in the area. We go about 1 hour away, as far as Sebastian to North Palm Beach.
Okay. Sebastian to North Palm Beach.
Mm-hmm.
Awesome. Very, very cool. So tell us a little bit in detail about a midwife. When people are, they find out they're pregnant, the first thing is, oh my gosh, I got to go to a care provider. I got to go to a doctor. I have to go to a midwife. So tell us a little bit about what a midwife is and what the difference between maybe a doctor or a care provider would be.
Okay. Well, a lot of the times you get really excited, you pee on that stick and you see your little plus sign and you're like, oh, I got to go tell someone. And you run and you tell your family. And it's funny how culturally we take a split. Some people say, oh, go tell the doctor, jump in right now. Go ahead right now. And others say, oh, time to go to call the midwife. In a lot of other countries around the world, that's one of their first go-tos. Oh, time to call the midwife. Get on the schedule. So when women come to us and they message us, usually we make sure that they know that they're looking for home birth. Because as a licensed midwife, I am only allowed to practice outside of the hospital. I am also only allowed to do low risk. So generally, moms have to be pretty healthy, pretty strong, pretty willing to maintain that status. And when I do need backup, we follow up with OBs and doctors who have that extra level of education and expertise that comes in handy when you're dealing with other things like hypertension or diabetes, or maybe you're 41 and a half weeks. Ooh, still normal. So we see you on the same schedule like an OB would, as a doctor would. And we do all of the same testing in our offices. We send for the same scans to make sure that baby's doing well throughout the pregnancy. And we care for you in a more intimate setting. I dare to say that around the world, we've seen that midwives giving care has reduced rates in perinatal mortality, babies being low birth weight, moms enjoying their experience, having control. And it really warms my heart to be a part of making those statistics look safer. So midwives, we're very much, midwife means with woman. So we're very much with a mom during their care.
I love that. Yeah. Learned something new. I did not know that about midwives, that it means with women. So I have a couple questions for you. So you don't do births in hospitals. So do you have a birth center or do you go to homes? How do you handle that?
In my practice, there are 2 midwives in my practice, myself and my mother, and we only do home birth. There is a birth center in the Treasure Coast, and they're fantastic. Their midwives are spectacular. And their birth center is their practice. We only do home birth. So whenever you get to be 37 weeks, you're safe and due to have your baby at home. So anywhere between 37 to 41 weeks, we make sure that you're all primed and ready. No birth centers though.
And do you, if someone was in that category that you are able to see where they're low risk, healthy, do you take care of all of their prenatal needs, or do they have to see an OB in conjunction with you?
We take care of all of their prenatal needs.
I love that. Much more holistic.
Yeah, we do a lot of throwing pills at you. If you get anemia, we're going to talk to you about your diet and see what we can incorporate. We're going to offer you some herbs like oat straw, dandelion, stinging nettle, things that are very nutritious, but not, you know, Western medicine. We can have a good mix of both Eastern and Western, a little bit of holistic and medical, and that can really help. You don't have to be too polarized.
Absolutely.
I agree completely. So do you work with doulas often? And what's your experience like with that?
I started as a doula during, like, right before midwifery school, about 11 years ago. And that's where my passion grew. But I decided like I needed a little more medical piece of it. And now, being on the opposite side of that window, I almost require doulas for some patients. Having a doula at your birth, particularly an out of hospital birth, can increase your chances of staying home. Plain and simple. You are more likely to enjoy your labor if you've got a doula who you've worked with a little bit prenatally, who can say, I see this is off of the path here. And whilst I, as a midwife, would love to supply all of that, I am often thinking about medically, what am I going to be doing for XYZ? And I need to be able to hold that space in my head to keep mom and baby and dad, whoever we got here in this room, in this house, safe and together.
I love that.
So
Wonderful.
I do require, I do highly recommend.
That's awesome. Well, you have tons of experience, Hailey. You've worked with doulas before. Do you have a number? I'm kind of putting you on the spot here, but do you have a number of births that you've been a midwife for? I don't know if you keep track of that number.
I keep a number of births that I've done total, because going back to start at my number one, my total of births that I've been at total is around 250. And my babies I usually catch between 28 and 38 babies a year.
Wow. Okay. So 28 to 38, you said, babies a year?
Yeah.
And you've been practicing for 7 years, you said?
6.
Awesome. 6 years. Oh, that's wonderful. That's so cool. So if we asked you what is maybe your favorite part of being a midwife in our community and serving the women in our community, what would you say that would be?
That is a really hard question, because I have two favorites. My first one for sure is watching everybody grow as a family. It's a piece of my passion. Community is in my blood. And I want to see your family blossom, not just you grow a baby. My second is definitely when a mom holds her baby first time. It feels like that exalting moment of like, I'm done and I did it and I'm the rock star. That's I love it. Give me all the day, every day.
Oh, that's so wonderful. That's so cool. Well, we thank you, Hailey, for being our guest tonight. We're going to
Thank
have
you for
all your
having me.
information on the last page, but I think I can speak for you and all of us that if you're out there watching and you need more information about what a doula is, what a midwife is, how can a midwife serve me during my pregnancy, reach out to us, call us, email us. We have those answers. Our information is evidence-based, and we want to serve our community. So we thank you so much for watching tonight, and subscribe, like, and we will talk to you soon. Bye, everyone.